Now, let's move to the first panel session of the day, which is about protection from SEAH in challenging contexts. During this session, our panel will explore some of the barriers to SEAH in difficult environments and ways to navigate these challenges. We'll start by hearing some reflections on a program called Closing the Accountability Gap, which was recently concluded in Bangladesh, and colleagues will offer early lessons learned. We will then hear from our esteemed panelists with experiences in MENA region, Turkey, and Eastern Europe, where they will share their experiences of embedding PSEAH prevention within their context. For this panel, we have 5 great speakers. They are Ranya Al-Jaberi, who is the former RSH Yemen National Representative. We have Lucy Haven-Taylor, who is a global trainer and consultant. We have Elena Cofaru, who is a former RSH Eastern Europe Romania National Representative. She's a safeguarding specialist and co-chair of the Romania PSEAH network. And we have Syed Rashed bin Jamal, who is program lead of Closing the Accountability Gap with the CHS Alliance. And we have Gamze Karadağ, who is the former RSH Turkey Hub advisor, and she's a safeguarding and gender expert. Let's start with Rashed bin Jamal, who will give us an overview of the Closing the Accountability Gap project as an example of one of the project's efforts to improve responses to SEAH and improve survivor center support in Cox's Bazar, Bangladesh. Rashed, over to you.
Thank you. Thanks so much. So hello, everyone, and thank you for inviting the CHS Alliance to speak at this session. My name is Syed Rashed, working as a liaison officer with CHS Alliance in Bangladesh, and I will be speaking about a demonstration project supported by the Dutch Ministry of Foreign Affairs that focuses on strengthening the response to SEAH in a way that centers around the needs of the victims or survivors and improves accountability of the aid actors. Now, the need for a victim-centered approach to PSEAH has long been recognized in the aid sector, but there is not a clear guidance on how to implement it when it comes to PSEAH. This project is contributing to fill that evidence and knowledge gap, and it is also shaped by larger movements in the aid sector, like localization and decolonization, which emphasize shifting power dynamics and working more closely with local communities and local actors. Here we have the next slide. Right, here you can see a photo from the Ukiah camp in Cox's Bazar, where 2 of the pilots intervened. So just to give you a background, the type of SEAH and the patterns and the profile and the different places and the situation of the complaint response mechanisms. So SEAH is commonly perpetrated in distribution centers, camp offices, and at service points. However, it also takes place in shelters, marketplaces, health centers, learning centers, and washrooms. Beneficiaries faced a lot of verbal and physical harassment, sexual exploitation in form of false marriage proposals, sexual abuse, including rape. Women, children, and adolescent girls are most at risk. SEAH are being perpetrated by service providers, volunteers from both the host community and the Rohingya community, NGO staff, and authority figures inside the camps. Places with a very developed PSEAH response compared to many other places, but research had identified broken complaint mechanisms. The reporting mechanisms were hard to access, confusing hotlines, distant complaint boxes, privacy and anonymity concerns, concerns with investigations, no feedback from investigations, and frankly, many survivors lose faith when they see the perpetrators still being inside the community, this engendering the perception of high level of impunity inside the community. Many perpetrations take place by volunteers after office hours or over the weekends when camp authorities and organizational staff were absent. With this scenario, with little trust in the formal CRM, survivors often turned to community leaders called Majis in Cox's Bazar and community women representatives for much quicker, easier resolution despite its imperfections. May we have the next slide. So here is how we operationalized victim-centered approach to PSEAH. First, we conducted a needs assessment among mapped civil society intermediaries, which included community leaders, midwives, GBV experts, social workers, and others, to better understand the challenges survivors face and assessed the effectiveness of the current PSEAH response and services available to them. This assessment was further refined through community consultation, where participants helped validate and expand on the findings of the needs assessment. Secondly, the findings from the needs assessment were taken into an open call for proposal for local actors to design interventions to close the gaps that had been identified. Third, local project advisory committee, we call PAC, reviewed the proposals and selected 3 pilots for implementation in Bangladesh. Finally, monitoring and evaluation framework and tools were developed to measure approaches, outcomes, and capture learnings from the pilot. May we have the next slide. In terms of solutions that our pilot had looked into, we trained local women representatives. We trained the trusted intermediaries on how to handle SEAH disclosures confidentially and guide survivors through the reporting processes. These representatives received SEAH disclosures and accompanied and supported SEAH survivors all throughout the PSEAH process, ensuring they were never left alone. The community representatives were even trained to negotiate with the organizations to keep the best interest of the survivor in mind all throughout the process, and at times raise concerns and negotiate on navigating the on-field inconveniences with confidentiality and ensure best outcomes for the survivor of SEAH. We also deployed community-based female Rohingya PSEAH focal points. These focal points regularly checked in with the families via door-to-door visits, raised SEAH awareness, then learned of stories and incidents, and connected the survivors to relevant support services and women-friendly spaces. On building trust and collaboration, local leaders and civil administration embraced the survivor-centered approach, linking formal channels with informal community-supported systems. Overall, 10,000 community members in Cox's Bazar and 26 public officials and camp authorities have been trained on victim-centered approach to PSEAH. Going to the next slide. Now, the learnings that came out of our intervention. So number one, PSEAH responses must be adaptable to different cultural and social contexts. The local mechanisms should be integrated into SEAH responses, even if it is imperfect. Perfection is a process, and it would be an error to disregard what the community has to offer. Secondly, global PSEAH policies should not be developed in isolation, but must be grounded in the realities of the communities they are intended for. There is need to incorporate local voices and systems for greater effectiveness, use, and trust. Number three, to overcome trust issues, civil society has a critical role to play. Handing over more responsibility to local actors can raise concerns about confidentiality and sensitivity, but it is essential for effective community-centered SEAH responses that respect community preferences. As such, this project fits firmly within AAP and localization approaches. There are persistent gaps in accountability and a lot of impunity. To address these gaps, organizations must have strategies in place to capacitate the trusted intermediaries of the communities, allow community representatives to inform, guide the PSEAH processes, and negotiate for the best interest and outcome for the SEAH survivors. So these are, in a nutshell, some of the learnings that came out of the intervention of the victim-centered approach to PSEAH project in Cox's Bazar. And then if there are more questions, I would be happy to answer from the chat box. Over to you for any questions or comments. Thank you.
Thank you so much, Rashed, for this extremely interesting presentation. And indeed, if you have any questions for Rashed, please use the Q&A box to pose your question and make sure to put down his name so that we know that this question is for him. And for all panelists, this is also a reminder to keep that Q&A box open because sometimes we may not be able to address these questions here in plenary, but they will be able, the panelists, to answer the questions in writing. So you will have your personal response to your question if you put them in the Q&A. Let's hear from Lucy Heaven-Taylor now to share some high-level findings from the program evaluation that you've been working on. Lucy, over to you.
Hi, thank you so much. So I was also working on this project together with Rashed, and the work that I was involved in was compiling the learning, not just from the work that was done in Cox's Bazar, Bangladesh, but the other project areas as well in Palestine and also in Ethiopia. And for myself, as a consultant who's worked in the sector for a very long time, I found it incredibly interesting to work on this project because I think that some of the things that were arising from it were really key and strong messages for the sector as a whole. First of all, in terms of the process, the how they went about the project. Now, we know this very well, that we need to meaningfully consult with communities and survivors. That's not a new concept to our sector. But I think what the project did very well was that it used local actors, local CSOs, and they were the ones who went out and did the listening to the survivors. And I think the messages that they were getting back were perhaps different, maybe stronger than what we might normally hear from doing this kind of exercise. And the key of those messages was really, unfortunately, the sense of the lack of trust in our sector to respond to SEAH cases, when in fact it was our organisations that were causing the harm. There was understandably a very big reluctance for us to then provide the solutions to that harm that had been caused. An uncomfortable message, but again, not one that probably comes as much of a surprise to us, but it definitely bears repeating and highlighting. So if there was a lack of trust in us, the aid sector, to address this harm and to investigate the harm caused, then where were the communities and survivors looking for this response? So what we found from the research and from the pilots was that, as Rashed has said in his presentation, there is no one size fits all. It can be very highly context specific, and what we heard from one location wasn't necessarily what we heard from another. And there was, again, an important message there that we do, of course, have global policies, procedures and frameworks, and those are very important for holding us to account as a sector. But also when we actually start to do the work, we need to really, really understand the context we're working in, how SEAH is perpetrated and how people already respond to it. And what we found in this project was that the individuals, the stakeholders, that the communities and survivors wanted to see dealing with SEAH tended to be stakeholders and mechanisms that were already in place. And again, it was different for each context. So for example, in Palestine, we found that a lot of communities and survivors thought that the police should be the ones who deal with SEAH because they're able to hold perpetrators to account. They were mandated to do so. As Rashed has said, in Cox's Bazar, it was the Maji, the community leader, or more often than not, the Maji sister, if the Maji was a man, or somebody associated with the Maji that might be female, that the communities identified as being the people that they wanted to be involved in responding to SEAH. Now, for us as a sector, that might seem like a strange response, given that we know, and the communities themselves said when we listened to them, that there are massive flaws in these structures for dealing with SEAH. In policing systems, in community leaderships, we know that they don't always use a protective approach, a gender sensitive approach, and yet still, because these were the existing mechanisms that the communities trusted, they were still prioritized over us as the aid sector as being trusted to respond to SEAH. So again, to emphasize the importance of then building our approaches from the community up and involving those trusted intermediaries, finding out who they are and making sure that they're involved in the programs. And as Rashed's examples from Cox's Bazar, we used local intermediaries in that project who were there and available in the community. And as Rashed mentioned, even after hours, when workers from our sector had left those locations, the trusted intermediaries from the communities were still there and were still able to act as interlocutors. All of this means that we, as the sector, are going to have to let go of a little bit of our power. And this can be uncomfortable. We have our systems in place. We have our compliance for responding to and investigating cases of SEAH. And it's certain that those compliance procedures probably don't include local leadership, for example. But we have asked communities and survivors how they want us to do this, and they've replied, and this is what they have said. So we need to take this seriously, even if that involves perhaps taking us as a sector to a place where we might feel a little bit uncomfortable. But if we are going to truly meaningfully implement approaches in PSEAH that are appropriate and meaningful for the communities and survivors that we work with, that is a step that we are going to have to take. So that's it from me. Thank you very much.
Thank you so much, Lucy. And just to repeat for our audience, I saw some questions about the presentations. Yes, they will be made available to you after the conference, not just the presentations, but also all the resources that are being presented and discussed during this conference will be made available to you afterwards via email. You will receive a message in your inbox with a link to a webpage that has all those resources and presentations just for you. And a kind reminder, if you have any question for our panelists, be sure to put them in the Q&A and be sure to mention the name of the person that you want to address with your question. So building on what Rashed and Lucy have said, we would love to hear from each panelist about the critical nature of CSO involvement in shaping robust SEAH responses. And my main question to you would be, what are the primary areas where CSOs can make a difference to address SEAH? I would love to start with you, Ranya. The floor is yours.
Thank you very much, Fabienne. Hello all, and I'm really delighted to have the opportunity to speak at such an important conference and to be among such distinguished speakers. So CSOs play a vital role in addressing sexual exploitation, abuse, and harassment, SEAH, especially in fragile contexts like many countries in the MENA region where I used to work with the Resource and Support Hub. One of the most important ways CSOs contribute to shaping SEAH responses is through community-centric approaches. CSOs are deeply embedded in the local communities, and this proximity allows them to tailor safeguarding measures to the culture, social, and legal landscapes of each region. For instance, in some areas, traditional gender roles and societal norms pose barriers to reporting SEAH incidents. CSOs can bridge these gaps by designing reporting mechanisms that account for these cultural sensitivities, ensuring survivors feel safe to come forward. Another critical area is like advocacy and influence on policy. So many governments, as you are aware, in the MENA region, don't have comprehensive legal frameworks that adequately address SEAH. CSOs are instrumental in advocating for policy changes, influencing national legislation and working with authorities to ensure that legal systems evolve to protect survivors. This is particularly true in conflict affected areas like the country that I used to work with RSH, Yemen, where local laws may not sufficiently protect against SEAH. Additionally, CSOs help ensure accountability within the aid and humanitarian sector by holding other actors accountable to the international safeguarding standards. They have the flexibility to adapt these standards into practical, localized policies that are realistic for their communities. This kind of adaptability is essential to ensure that SEAH policies are both understood and implemented effectively on the ground. In the absence of strong government oversight, CSOs many times become the guardians of safeguarding in their respective regions. Really, the list of the important points regarding the role of CSOs is really quite long, but in the interest of the time, I have just focused on the above points, which are the critical role of the CSOs in shaping SEAH responses lies in their ability to adapt global standards to local context, what we call the contextualization and localization, advocate for strong legal frameworks, and hold the sector accountable for the communities they serve. Thank you very much. Over to you, Fabienne.
Thank you so much, Ranya. I'm also curious to hear from you, Elena. According to you, what are those primary areas where CSOs can make a difference to address SEAH?
Thank you very much, Fabienne, and thank you to the Global RSH team for having me today here in a different function than we used to collaborate in the past. But to answer to your question, I would like to share an example from my work as a national representative for RSH Eastern Europe in Romania, and I will be focusing on a very concrete case, the close collaboration that we had with the National Association of the Deaf, an organization of people with disabilities that significantly advanced safeguarding efforts for them. To give you a bit of a context, when RSH in Eastern Europe was established in 2022, one of the most pressing needs identified was the high SEAH risks faced by Ukrainian refugees with disabilities. Organizations representing people with disabilities became a key priority in our strategy to address SEAH. We worked with them to provide tailored support, including training, webinars, and advisory services, with the overall objective to help them build or strengthen their safeguarding systems. The National Association of the Deaf in Romania stood out as an organization that fully and meaningfully embraced this safeguarding journey. Their commitment to the development of a comprehensive safeguarding policy, followed by measures were put in place to protect their beneficiaries. And all these efforts culminated in their selection by ICFA as a 2023 grantee under the Interagency PSEAH Community Outreach and Communication Fund a program of ICVA that Alun spoke about earlier, and I definitely encourage all members of CSOs present here to apply whenever this call, is open annually. So basically, through this grant, they developed critical resources on SEAH in Romanian and Ukrainian sign languages, including videos and as well a brochure for humanitarian workers. These materials, they were truly groundbreaking, as there had previously been no SEAH-related communication resources adapted for people with hearing impairments in these languages. This gap in knowledge increased, of course, the SEAH risks for people with hearing impairments, as they often lacked the vocabulary or awareness to report instances of sexual misconduct. Additionally, what the National Association of the Deaf in Romania saw was that there was very little guidance for aid workers on how to appropriately communicate with individuals with hearing impairments. So in a nutshell, the resources that they created, of course, through consultations with both Romanian and Ukrainian communities suffering from hearing impairments, became a milestone in addressing SEAH and disability in the Ukraine response. So yeah, this was an example from Romania, which I think that genuinely and meaningfully illustrates how, a CSO can tap into their cultural understanding, local expertise to make a significant difference by tailoring, the safeguarding systems to the specific needs of the vulnerable communities that they represent. Thank you very much. Over to you, Fabienne.
Thank you so much, Elena. That was very inspiring. I see in the Q&A box, there's quite a number of questions coming up, which is really nice. Some great comments, especially for Lucy. I also see for Ranya, Rashed. So panelists, please keep an eye on that Q&A box because you have the power to answer them in writing. So let's hear from you, Gamze. I have the same question for you. What are the primary areas where CSOs can make a difference to address SEAH? Over to you.
Hello, everyone. My name is Gamze Karadağ. I'm attending the conference from Istanbul, Turkey. I work for Support Life Association as Gender Equality Safeguarding and Inclusion Manager. First of all, I would like to tell you briefly about my organization. SEAH Support Life is a humanitarian organization that was founded in 2005. We work for access to rights and services for people and communities affected by disasters. We work in the areas of emergency relief, refugee assistance, child protection, child labor elimination, stakeholder capacity building, and localization. As SEAH, for the past 3 years, we have been working with UNHCR to provide capacity building support to local NGOs in Turkey for at least 1 year. In this program, we support organizations through joint trainings, mentoring and supervision on PSEAH, child safeguarding, and GBV risk reduction. Unfortunately, femicide, violence against women and girls, gender-based violence, and child abuse have been on the agenda in Turkey for many years. Women's, children's, and human rights activists and NGOs continue to work on these issues, and unfortunately, they become areas where we have more difficulties and need solidarity. There are difficulties such as inadequate legal sanctions, social judgments against seeking support, victim-blaming attitudes and discourses, mistrust of the justice system due to lack of punishment for perpetrators, and mistrust of law enforcement, which can make survivors reluctant to report. It has become even more important to discuss and advocate for these issues. Talking about sexual exploitation and abuse is almost as forbidden as talking about gender equality in Turkey. Cultural approaches such as not in our culture and the patriarchal social order are barriers to talking about issues such as violence against women, sexual exploitation, sexual violence. We know from our own experience that when we give a training on PSEAH to a small local NGO, discussions may arise, participants may personalize the issues and take a not in our culture approach, or they may be reluctant to see and talk about such issues as a part of their work. After the earthquake on February 6, 2023, we unfortunately realized that information about PSEAH was not available in small-scale NGOs. Therefore, as a child protection cluster, we first organized trainings on child safeguarding. Then as a PSEAH network, we organized PSEAH induction and focal point trainings for local NGOs working in disaster areas. Through these trainings programs, we have tried to ensure that smaller organizations can fulfill their commitments under the PSEAH. After the earthquakes, the increase in the number of missing children has changed people's perception of safety. The demand from the NGOs working with the children to improve their capacity in this area has increased. Again, we have seen cases of GBV in the irregular disaster response operations that were carried out after the earthquake, and there were women and girls who were subjected to harassment and exploitation by various NGO volunteers, staff, public officials, faith-based relief workers, communities, or leaders. We know that in order to respond effectively to these cases, it is essential to build the capacity of organizations in the field of safeguarding. The implementation of coaching, mentoring programs is very important in this regard. Thank you very much. Over to you, Fabienne.
Thank you so much, Gamze, for sharing your perspectives. Now, we've heard a lot about different experiences and also a lot about challenges. Let's move on to collaborative solutions and future actions. Lucy, I have a question for you. According to you, how can international organizations and donors better learn from local actors to enhance PSEAH and put that learning into practice? And when you're answering this question, could you give some concrete examples from your experience or draw from your latest research?
Well, I think that the project that we've just shared is a very good example of this. So I would say, I think any organisation that's already working participatory approaches and listening to its stakeholders is very well placed to engender this kind of learning. And there are also plenty of resources out there to help you with this as well, just as an aside. We're not the only ones doing this. There are projects such as the Empowered Aid Scheme and Oxfam's work on barriers to disclosing misconduct, etc. So just to say that there are resources out there, and they will be available on the hub. In terms of how donors and others can learn from this, again, I would just say it's just about listening. If you are going to consult communities and survivors, make sure you're prepared to listen to what they say and to look at ways that you can actually go ahead and implement that, rather than just undertaking a consultation and then continuing business as usual. I think now that our work in the sector on PSEAH has matured, we've been doing this work for quite a long time. I think it's time for another step change in how we actually approach this, because whilst we are seeing some success, as colleagues have already said this morning, we are still facing huge issues in terms of sexual exploitation and abuse. So clearly we need to look at how we work and maybe do more and do it differently.
Thank you so much, Lucy, for this. And I'm also curious to hear from you, audience. We would like to know, what are your ideas on how international organizations can learn from local actors to enhance SEAH responses? If you have anything to share on this, any reflection at all, please share them in the chat. And of course, if you have any questions for the panelists, for the speakers, put that one in the Q&A box. So we've heard that collaboration is key to preventing sexual exploitation, abuse, and harassment. Let's see how we can continue improving collaboration between CSOs and other actors to improve SEAH responses. Rashed, would you like to share your thoughts on this?
Sure. Thank you so much. So in terms of collaboration, from my context, we have different players working and joining hands to basically ensure prevention of sexual exploitation, abuse, and harassment, and also ensuring proper responses to the survivors and victims of SEAH. Some of those actors are, of course, we have the PSEAH network, both in Dhaka and in Cox's Bazar. We have the Resource and Support Hub Bangladesh. We have the national representative, Nahid, who has already joined this meeting. They have been very helpful. We have platforms like Nirapod and Nahab. These are networks of local NGOs gathering together to basically have support and technical expertise from organizations who possess those expertise and sharing with the less resourced organizations in Bangladesh. We also had the good fortune of collaborating with the government actors, especially in our Closing the Accountability Gap project, where the Honorable CIC, the camp in charge, who are executive magistrates, were totally on board, and they have given us the permission and the capacitated us, helped us to navigate the different administrative challenges and reach out to these community actors who people of the community were already resorting to, that had developed organically within the community, to basically tap into that potential and provide them with capacity development, trainings, and orientation to work better, to have disclosures and refer for the services for victims and survivors of SEAH. There are, of course, the HR working group in Cox's Bazar, where all the HR of different organizations come together to discuss the different challenges with their reference checks and vetting processes, wherein PSEAH Network, CHS Alliance, Resource and Support Hub all together worked to ensure that these are all taken care of, properly done, to ensure that that a perpetrator who had been dismissed from service do not necessarily get into the service with any other organization. So there is a lot of collaboration happening from the networks and different platforms, both in Cox's Bazar and in Dhaka, with UN agencies and INGOs and local organizations. Some of the local organizations are championing the process. The current project that CHS Alliance has launched in Bangladesh, the Harmonized reporting scheme for SEAH. There are champions who are also trying to localize the Harmonized reporting scheme. Some of the local agencies are also coming forward, apart from the networks and different hubs. So I think overall we have had a very good collaboration and it is yielding a lot of results in ensuring. But then no system is airtight. We're still in the process of making sure that all avenues are covered, but then collaboration takes you a long way rather than being isolated on your own. So over to you, Fabienne.
Thank you so much, Rashed. That was really interesting. Let's see, Ranya, what would you like to add to that? So according to you, how can we continue improving collaboration between CSOs and other actors to improve SEAH responses?
As part of the RSH, I was privileged to learn from the best practices of several CSOs in the MENA region. So based on that, I will build my response to continue enhancing collaboration between CSOs and other actors in addressing SEAH. It is really essential to focus on building trust and shared responsibility. Collaboration works best when all stakeholders, from the international organizations to local CSOs, operate under a unified understanding of the importance of safeguarding. This can be achieved by promoting regular dialogue and knowledge exchange through national and regional networks, like the PSEAH network in MENA, where, for example, where the RSH used to work, mainly Yemen, Jordan, and Syria, northwest, northeast of Syria. These networks share best practices and coordinate responses, ensuring that resources and expertise are shared across borders. Another approach is to increase the involvement of local communities in decision-making process. CSOs should actively involve communities in identifying risks and developing solutions for SEAH. This bottom-up approach ensures that safeguarding initiatives are rooted in the realities on the ground. For example, in Jordan, collaborative efforts between CSOs and local communities have led to the development of community reporting mechanisms that are both culturally sensitive and acceptable. By empowering communities to co-design SEAH strategies, we can ensure that responses are more sustainable and effective. Also, leveraging the technology is another key area, especially in our era, for improvement. In region like Syria, mobile applications for reporting SEAH, such as SARA application, have proven effective in increasing the accessibility for survivors to report incidents anonymously. CSOs can work with other actors, including tech experts, to create innovative solutions that enhance reporting mechanisms, especially in remote or conflict-affected areas. Lastly, capacity development and joint training initiatives are critical. By conducting joint training programs, CSOs, networks, or unions can help build the capacities of the less resourced and small CSOs in their countries or regions, ensuring that safeguarding knowledge and skills are embedded at all levels. For example, in Yemen, where I used to be the RSH representative, there are several CSOs networks and unions have worked to provide training on SEAH policies and best practices, helping create a pool of SEAH advocates with little resources that they have. As Peter mentioned, in SEAH, we are facing problems in financing and funding. So this type of collaboration ensures that local actors are equipped to share the knowledge, fostering also the sustainability. So this is my share. Over to you, Fabienne. Thank you.
Thank you so much, Ranya. I'm also curious to hear the perspective of Gamze, specifically from the Türkiye hub. Gamze, would you like to share?
Of course, Fabienne, thank you. I would like to briefly talk about the process of establishing the Safeguarding Resource Hub Türkiye Hub. In 2023, right after the earthquakes, we met with the Safeguarding Resource Hub team and developed the cooperation for the opening of the Türkiye Hub. At the very beginning of the program, we held a workshop with experts from Turkey, including UN representatives, INGO and NGO representatives, and agreed on the meaning of safeguarding in Turkish. As part of the program, Turkish and context-adapted versions of the first 3 modules of the Safeguarding Matters online training were published. We translated and context-adapted more than 50 resources in the Türkiye Hub library and made them available in Turkish. At the same time, we launched a safeguarding coaching program and supported 10 NGOs to develop policies, improve their complaint and feedback mechanisms, and develop their organizational capacity through coaching program. This coaching program was one of the most useful activities. The main request from the NGOs participating in this program was that such programs should be longer. There is a need for cooperation among organizations in Turkey to combat sexual exploitation, abuse, and harassment. It will make difference if localization-oriented networks of disaster preparedness NGOs, and other advocacy-oriented national networks consider PSEAH and child safeguarding issues as a priority development areas and implement long-term capacity building programs. More peer learning and exchange space for PSEAH and safeguarding focal points would be beneficial. The practice of working with such communities together with community-based approach to protection and local-led empowerment will support communities to use complaint and feedback mechanisms for their own safety. Another important issue is to learn more about international programs such as Resource Support Hub that work internationally and include examples from different contexts, and to diversify the learning areas. Developing a national pool of investigators to intervene in SEAH cases is an important need for Turkey context. PSEAH network, Türkiye network has decided to implement interagency risk assessments under the guidance of the task team and will complete this risk assessment at national level next year. We are making plans by working as network members on all the needs and ways of cooperation that I have just mentioned. As a civil society member working in the field of PSEAH since 2015, we have come a long way in Turkey in terms of PSEAH. However, as a country with a population of more than 80 million people and many obstacles to gender equality, we still have a long way to go. Our biggest dream is to walk these roads together for accountability. Thank you all. Over to you, Fabienne.
Thank you so much, Gamze. And finally, we would love to hear from you, Elena. What are your thoughts on improving collaboration from the Eastern European perspective?
Thank you very much. I think I would like to mention first that in Eastern Europe, we can see that resources dedicated to SEAH efforts are becoming increasingly scarce. There are fewer subject matter experts, trainings, and awareness-raising sessions happening for the affected communities. But nevertheless, there have been successful initiatives that have, strengthened the collaboration between CSOs and other actors. And I think, this will continue in the future. I'll be drawing on my experience as a co-chair of the PSEAH network, which in Romania has been active since 2022, April 2022, because I've witnessed firsthand how collective efforts can drive significant progress. The network in Romania brings together over 40 entities, UN agencies, CSOs, local authorities, and very recently refugee-led organizations, which for us it's a plus and it's a moment of happiness, right? And is attended by the designated PSEAH focal points of those organizations. It does serve as the primary platform for awareness, prevention, and oversight of SEAH issues in Romania. So one major outcome of the network's collaboration was the development of the interagency standard operating procedures for handling SEAH complaints. The key objective of these SOPs is to define the necessary actions in cases of actual, suspected, or alleged SEAH committed by aid workers. The initiative arose in response to a collective concern from the network members about a number of allegations of misconduct involving staff or associates from other humanitarian organizations as well as unknown organizations. So in a nutshell, what was happening was that staff member from a CSO was receiving a complaint about misconduct committed by the staff member of a different organization. So there was absolutely no referral pathway. Nobody knew how to handle this, how to report. And of course, there was the problem that the victim was not receiving the appropriate assistance. So the SOPs helped us standardize the interagency referrals to ensure that no complaint was or is going to be lost or mishandled, and that all victims receive appropriate support. Equally, for us, the SOPs have been instrumental in addressing some other challenges that we know they are recurrent, not only in Eastern Europe, but also globally, which is misreporting and underreporting issues. It is a key success. I consider it a key success. The involvement of the CSOs has been the key success, because I think that, you know, thanks to their involvement, the procedures will continue to be used beyond the response to the Ukraine crisis. So I see it as a good practice. I wanted to share it with all the participants today, because I think that it can be very easily replicated by other networks or other spaces to improve the SEAH response mechanisms. That's it from my side. Thank you very much.
Thank you so much, Elena, and other speakers as well for giving such inspiring examples. Now we have come to the end of this panel on promoting SEAH in challenging contexts. I hope that everyone has some takeaways to consider in their day-to-day work. We have spoken about 3 key areas. We've spoken about encouraging collaboration among CSOs, donors, and other stakeholders to enhance SEAH prevention efforts. We've spoken about actively listening and undertaking meaningful discussion with civil society actors when designing programs to work towards sustainable and more localized interventions that effectively mitigate SEAH risks. And utilizing existing networks effectively, such as PSEAH coordination groups for continuous learning. I want to extend a big thank you to you, Ranya, Lucy, Elena, Rashed, and Gamze for your wonderful contributions.